So I'm talking to Massimo now, and Massimo, thank you for talking to me.
Pleasure.
I understand that you've got some of the best talks, I think, here today at the symposium. It certainly has the best title for one of your clinics. Can you tell us a little bit about what you're going to talk about?
Well, if you put the word sex in the title of a talk, you're sure to attract a lot of attention. So when Bruce approached me 6 months ago, the general topic was going to be sexual health of men who have sex with men. And then PrEP funding by Pharmac caught us by surprise, and we thought we definitely had to cover that topic. So that will be the main topic of the main talk. And then in the clinic, we will approach more general practical skills for MSM sexual health on a Monday.
Yes, so can you tell us the name, the title of your talk was?
The title is Monday of Anxiety, I think it is, after a weekend of gay sex. So we will explore what needs to happen when someone comes to see you in your practice on a Monday and they've had at-risk exposure with unprotected sex during the weekend. What do you need to do?
And I think this is a topic that not all GPs know a lot about, so it's a really important thing to get out there. So what would you like GPs to take out of your talk today? What was the most important thing?
Basically keep calm, cover the basics, ask the right questions, and don't be afraid to ask the right questions. And then, document everything appropriately. So please don't document homosexuality as a diagnosis. It's not a thing anymore. It's not a disease. We document the behaviors. So that's why we use the term MSM, men who have sex with men, because that describes the behavior, doesn't put people in a category, in a pigeonhole. And then the basics will be do a full STI screening for baseline screening, which for MSM will include 3-site sampling for chlamydia and gonorrhea, throat, urines, and rectal for all MSM, regardless of whether they tell you they are insertive, receptive, tops, bottoms, doesn't matter. Everyone gets tested in the 3 sites. And a blood test as a minimum for HIV and syphilis, perhaps hepatitis if clinically indicated. And then I guess town by town, if I was a GP, I would definitely be keen to set up referral pathways with my sexual health and infectious diseases services and EDs for after hours cover. Where and how do I refer when people need post-exposure prophylaxis? Where and how do I refer when people will benefit from ongoing pre-exposure prophylaxis? Everyone is stressed, everyone is under-resourced. It's very important we work together to establish the best pathway possible in our own local reality.
Do you have any particular tips for how people who may not feel particularly confident with bringing up these questions or doing these tests on their patients, how do they lead in? How do they soften sort of the discussion so that it's fairly intimate, and how do they make that comfortable?
Absolutely. Well, you can always introduce with a blurb like, I'm going to make some intimate questions. Feel free to tell me it's too intimate and you don't want to answer, but it will be really important for me to appropriately look after you if I know exactly what's been going on. And then practice. Because essentially, if you're not comfortable, your body language will definitely show you are not, and the other person will immediately shut down. So you need to be comfortable and make it sound normal, like this is something we ask to everyone because we want to be sure we are delivering the appropriate care to all our patients.
And you mentioned the prophylaxis and all the new guidelines and things that are funding that's come out. Can you tell us a little bit about that then?
About HIV?
The PrEP.
Okay. So pre-exposure prophylaxis essentially means giving to people at high risk of contracting HIV, but who are HIV negative, antiretroviral drugs to prevent acquisition of HIV infection. If you want to make a comparison, it's a bit like taking anti-malarial prophylaxis when you go to Africa. So you take a medication that's supposed to prevent acquisition of the infection. In New Zealand, one of the first countries in the world, so we need to be proud about that. From the 1st of March, pre-exposure prophylaxis for HIV is funded for high-risk MSM and transgender persons who fit the special authority criteria. There will be challenges because the first application needs to be made by a named specialist. So, that's why I say people will need to sit down with their own specialists and set up referral pathways.
Yes.
And then repeat prescriptions every 3 months can be done by a GP.
Right.
But, there are criteria, and the first criteria actually is that the applicant needs to have up-to-date knowledge about PrEP and all related matters.
Yes.
So there needs to be an ongoing learning process, actually.
Yes, and are we going to roll out some education about this as well?
Yes, absolutely. We're going into details about the indications, the process, what tests need to be done at the start and ongoing. And
it's a really important thing, and I think, as you say, with all the new changes that are coming out, people need to stay up to date. And
we are starting funding PrEP in New Zealand possibly in the worst possible moment because we have an ongoing epidemic of syphilis and very high rates of gonorrhea and chlamydia, much higher than the countries we normally compare to, like Australia, Canada, and the UK. So we start PrEP in a very unfavorable environment. Plus, as I say, everyone is overworked, everyone is stressed. Sexual health services have had cuts in some important areas, like in Auckland. So these are definitely challenges, and I don't think we can overcome these challenges unless we work together, secondary and primary sector.
So get those conversations going on the basis of what's available now.
Get the conversation started, absolutely.
Thank you so much, Massimo. It's really interesting. Thank you.
Cheers.